time out of your busy schedule on Saturday for this health forum. The goal of the forum is going forward to have more of these, so that's why I wanted you guys to fill out the information so that we could keep in contact with you and be able to give you, updates and stuff like that. So today's topic is heart disease. In the future, want to be able to do stuff on diabetes and cancer prevention and so on and so forth. So another announcement, just also make sure you guys get familiar with the staff over here, at Grand Auto Care. When Chris gets here, definitely communicate with him. If you're not already coming over here, make sure that you are, because this is the place where, you want to do your car care, servicing and stuff. All right? So just a quick background about myself. I have a master's degree in nutrition and exercise science, and I've been in the field of nutrition working and doing my thing for the past 12 years. So, all right, so we're going to get started. I'm only going to ask that we save any questions for the end when I get through all of the slides. All right, Jabari, you're going to have to sit down,
all
right?
Do you mind if I check in? I took a picture of you, but do you mind?
Yeah, you can take pictures. Okay, you can take pictures. You could record. It's fine. It's fine. So, all right, so let's begin. All right. By show of hands, how many people are either suffering from heart disease or have somebody in their family suffering from heart disease? All right, I got both of my hands up because on both sides of my family I have people suffering from heart disease. All right? Now, if you don't have heart disease, are you concerned about eventually getting heart disease? All right? So, I'm going to show you why you should be concerned with that. All right? Does anybody know how many people died of heart disease last year in this country? Take a wild guess. Take a wild guess. 100,000? What did you say? 100,000? A little bit higher than that.
300,000.
The answer is 600,000 people died of heart disease. Over 600,000 Americans died of heart disease. 40 years ago, the number one killer in the United States was heart disease. Before I was born, right? I was born 1977. 1976, it was the number one killer. Now, 40 years later, after procedures, after medications, statin drugs, after all this money they've put towards heart disease, it's still the number one killer. So this is a very, very big problem. All right? So 46% of the African American male community is affected by heart disease. That's almost half of our population, half of our male population. And 795,000 people have a stroke every year in this country. So these are some serious issues. Now, for African American women, 40% are likely to have heart disease or stroke. And in the Latino community, we have 30% of the Latina community that are affected by heart disease or stroke. Now, I just found out about this statistic. 1 in 2 women of color in the United States will die of heart disease. So that's why this is very, very important.
That's crazy.
Yeah. So this disease is not only killing us, but it's also killing us in our pockets. $320 billion is going towards when you go to your emergency room, doctor's appointments, procedures, medications, all of that is pulled into this amount of $320 billion. All right? To have a stent entered into your artery, to open up the artery, it's going to cost you $28,000. $117,000 for bypass surgery. And then for heart valve replacement, it's $164,000. So this is a very expensive disease. Now, do you guys know, there's a lot of people who know that they got to go to the gym, they've got to exercise, they got to do certain things, but they don't do it. All right? Why would somebody not do the things that they need to do? You guys have any clues?
I was going to say, I can speak for myself. Procrastination.
Okay, procrastination.
Being lazy.
Putting others before themselves.
That's true.
Not
That's
enough
true.
time.
Not enough time. Okay. All right. I think that one of the things that a person has to establish for themselves is that they have to have a why. They have to have a strong enough why. one of my whys in my life represents my family, represents my son and my wife. They're the reason why I work as hard as I do. They're the reason why I make sure that I take adequate care of myself. They're the reason why I'm working constantly to build my business and do what I do. So you have to have a why, in addition to everything that you guys just mentioned, procrastination. You got to eliminate procrastination. You got to eliminate any form of laziness or anything like that. And, also identify what your why is. Your why could be, you have heart disease in your family and you don't want to be the one to have heart disease. So that's a strong enough why. How many people like the Fresh Prince of Bel-Air? Yeah. He's not here right now. I don't know where he went, but my son likes to sing the theme song. So he goes around the house singing the theme song and everything. So in this episode, Uncle Phil had a heart attack. At the end of the episode, he comes out of the hospital and he tells the family, he says, listen, I don't want this to ever happen to me again. So what I'm going to do is I'm going to exercise, I'm going to eat right, and I'm going to make sure that I'm here for you guys. Now that's a why. That's a very powerful why, because, this is TV land. So in TV land, you get to come back home. But a lot of the times for our people, that first heart attack sometimes is the last one. So that's the importance of your why. This, I had a video that I took from YouTube of the actual thing, but it's not playing, so next presentation. All right, so we've gotten through all the gory details, so now let's come up and talk about solutions. All right, so this is the 7 pillars, my 7 pillars towards optimum health. All right, obviously nutrition is a very important part of it, but when it comes to overall health, the approach has to be, multifaceted. There's different areas that you want to focus on when it comes to health. Your nutrition, your sleep affects your weight loss and heart disease. Your social family affects your heart disease and weight loss. You guys don't have to take pictures because I got, I'm at the end of the presentation, I'm going to give you some of the things. I mean, if you want to take pictures, you can. But I'm going to give you...
I already know you, so I was already cutting.
Yeah, I got them over there, but I want to do this first and then give you the slides and stuff. All right, so your life purpose is also part of your health and longevity and wellness. Exercise, of course. Meditation, spirituality, spiritual exercise is also important, and mental health is very, very important. Now, nutrition, probably one of the most important things. And when you have heart disease, you have to make a decision to change certain things in your diet. And a plant-based whole foods diet is very important towards mitigating and reversing the symptoms of heart disease. Plant-based whole food diet is going to provide you with magnesium, fiber, calcium, your B vitamins, your A vitamins, all the nutrients that's needed to support your heart. All right, so you're going to have broccoli and kale and asparagus, sweet potatoes. You're going to have this spectrum of all of these different nutrients that's providing you with all those different phytonutrients to support your heart. Artichokes, beans, and then whole foods like brown rice, quinoa, your whole wheat oats, cornmeal, the wild rice. All of these things are important to support the heart, providing with the antioxidants and all the nutrients that it needs. And then you're going to use the balsamic vinegar with your salads. Now the plant-based whole foods diet, it was something that was made very well known in regards to heart disease by Dr. Caldwell Esselstyn. He wrote this book right here called Prevent and Reverse Heart Disease. And in this book, he talks about a study that he did with about 120 patients. And he put them on a plant-based whole foods diet. All right, they all had heart disease. Some of them had heart attacks, some of them had strokes, and he was able to reverse all of their symptoms. All the ones who complied. There were certain people that didn't comply, and of course they didn't receive the same benefits. But he chronicles everything in this book. There's recipes in this book, and he is, he had a lot of success. Dr. Dean Ornish also did a very similar study with, I think, 200 patients. The difference between him and Dr. Esselstyn is that he had incorporated meditation and lifestyle changes, and he also it was more of a vegetarian diet. So he allowed more things on this particular diet. But basically it was the same results. It was the same results. And here you see former President Bill Clinton. How many people know Bill Clinton had bad heart disease?
Yeah.
He had open heart surgery, bypass surgery in 2004. And in 2010, when he was in Haiti for the relief efforts for the earthquake, he had started to experience chest pains. So he flew back from Haiti to the United States, and the doctor told him, you need a stent. So at that point, he was just tired of it. He was just like, I'm not doing this anymore. I'm going to do research. I'm going to figure out a way to deal with this heart disease. So he started to work with Dr. Dean Ornish. He started to research this book, and he changed his diet to a plant-based diet. So in this picture right here, he's on CNN talking about the plant-based diet. They were doing a special on heart disease. And he talked about how all of his levels are normal. His blood pressure is down. His arteries are clear. He's like the same weight that he was in high school. So, you know, the science is here. I'm just telling it to you. The science is already here. All right, so on the plant-based whole foods diet, these are some of the foods that you're going to avoid. Dairy, because of the saturated fat. I think that almond milk is a great alternative. Your refined grains, white rice and enriched white flour, they're stripped of all their nutrients. So they're not providing you with any nutritional value. You know, you're going to refrain from red meat, refrain from eggs, avoiding sugary drinks like fruit punch and those types of things because they cause inflammation. Stay away from excess salts that's coming from canned foods and things like that. Caffeine raises up blood pressure. Processed food. And also when I was doing research on olive oil, I found out that olive oil has about 14% of saturated fat. So the people that use olive oil and are trying to lose weight, but not realizing why they're not losing the weight, you know, so that was something interesting I came across. So a better alternative to olive oil is coconut oil, the organic coconut oil. Of course, because it's real hot, you know, it's liquidy. All right, mental health. Mental health is very, very important because our brains is basically like a computer. All right, you program your brain. Everything that you are exposed to is programming your brain. So you want to consistently provide your brain with positive affirmations, positive information, so that you've got that positive input and that's the output that you're showing. Because, you know, our brain, this is a saying, garbage in, garbage out. You know, so if you are watching things like the Jerry Springer show, you know, with the fighting and the cheating and stuff like that, all of that is stress on our brains. You know, when we watch a regular news program, you're going to hear about stabbings, killings, murders, the war on drugs, the war on crime. Those are very strong words. They're very stressful words, you know. And what the problem is that the news is coming on at night. And you're exposed to all of this information and that war on terror. And you taking that stuff and you going to sleep with all of that energy, you know. And it's staying. And you wake up with that stress, you know. So what I like to do is I listen to, in the morning time when I get up, I listen to Tony Robbins. Sometimes I listen to Les Brown. A really good book, The Power of Positive Thinking by Norman Vincent Peale. Talks about affirmations, talks about different ways to program your mind for positive thoughts. And you have to have a positive frame of mind when you're trying to change your diet, when you're trying to be healthier, you know, so that the stress is not going to cause you to go back to the sweets and go back to the sugars and go back to those foods that, you know, is hurting us.
Comfort foods.
Comfort foods, exactly. All right, your family health, your social health. This is a very important area right here because a lot of us need support when we're making major changes in our lives. If you're going through a chronic disease or you want to have weight loss or you're going through problems, you need social support. You need the help of your, you know, closest friend, closest confidant, your husband, you know, your family member, you know, to help you get through those difficult times. And the science is there that shows it. All right, studies have shown that elderly people who have great social relationships tend to live longer. All right, an uplifting conversation could change someone's outlook on life, you know, a problem that they're dealing with. So if you're going through something tough, you're going to call somebody and be like, yo, I just lost my job, or I went through something. I mean, we all go through challenges, right? All of us go through challenges, you know, and we all have somebody that we could call on, right?
Yep.
Right? So positive, close, intimate relationships has a positive effect on your health. A study showed that women diagnosed with cancer and had marriage and family support have an increased chance of survival. So the science is there. All right? Your life purpose. Your life purpose is very important. You need to know why God created you, why you're put on this planet. All right? You have to do what you love every day. Love what you do what you love. And it's something that gives you an extra sense of purpose. It's something that makes you want to get up and be healthier. You know, whether you want to be a comedian or a hairdresser or a real estate agent, a cook, you know, or a teacher, you know, you want to be healthy. So that means that the weight's got to come off. You know, the heart disease has to be under control. Because if those things aren't under control, you can't serve your purpose. You can't do what God intended for you to do. You know? So that's why this is very, very important. Your purpose or your calling can potentially add years to your life. Alright? Do what you love what you do. If it won't feel like work. Alright? And if a person doesn't know what their purpose is, then you got to find somebody that does and help them reach to their purpose. Whether it's a child, whether it's a spouse. And in that process, you eventually will learn what your purpose is. All right? This is a story about a real estate broker, and he's been in the business for 63 years. He's 92 years old, and he's still working. All right? 7 days a week. He goes into his office 4 times a week. When he's not in his office, he takes his laptop with him, and he goes home, and he's constantly looking on his laptop, constantly doing work. All right? And he says that his secrets to longevity, he stopped consuming red meat 40 years ago. All right? He eats mainly chicken and fish and lots of vegetables. He avoids junk food. He exercises every day. All right? And he has a cycling machine in his office. All right? And more importantly, he loves what he does. He loves what he does. This is what his passion is. Most people at 92 years old, what are they doing? Sitting down sleeping, if they're alive, in the nursing home, you know what I mean? So this guy is defying all the odds. Why? Because he knows his purpose. All right? So very important. You take that passion of what your purpose, your life purpose is, and you put that also into your health. You put that also into your weight loss. All right? Exercise. The biggest challenge about exercise for people is that, you know, some people don't like to jog. You know, I don't like to run. You know I got to do it, but I don't like to do it. You know, so you got to find what you like, what you love. You know, whether it's swimming or running or jogging. Y'all want to see what I like to do? All right, I need a volunteer. Who wants to volunteer?
Not everyone come at once. Not everybody can start at once. Go ahead.
How about
All right, this is what I like to do to release stress.
This is what I like to do. That's put it on.
I like to hit.
Oh, wait, hold on. Sorry.
You gotta do Lucky
I'll
Crowd.
do Lucky Crowd.
Uh-oh, she's getting ready. She is a pro.
All
He
right.
knows I do a little bit.
Okay. Let her rip. Yeah. Oh yeah. Yes. Uh-huh. Keep going.
Okay.
Uh-huh. Uh-huh.
That's right.
All right. See? A little 10 minutes of that, 15 minutes of that. Great way to release stress.
Absolutely. Yeah.
Great way to release stress. Thank you for being my volunteer.
And you have to note that you had a smile on your face the entire time you were doing it.
You enjoyed it. You enjoyed what you were doing. And that's the importance of exercise. You got to just find what you like. What's the exercise that you like? All right. So your aerobic exercises is going to improve your blood pressure. Jogging, running, bicycling, even walking. Walking is an aerobic exercise that also benefits the heart. All right. So, and of course, before commencing any exercise, you want to do your stretching, at least 3 minutes of stretching. All right. Okay. How many people like sleep?
Love it. Woo!
Get it.
How many hours of sleep you got last night, Tashika?
Maybe 7.
7?
Nice.
Okay.
Right?
That's a good day for me too.
Joyful night.
That's a great day for me.
Yeah.
Febin, how many hours of sleep you got?
About the same 7.
7?
Wow.
I think maybe 5 or 4. I went to bed thinking about too much stuff.
Okay. Okay. Monroe?
I went to bed at 2 o'clock in the morning. I got up at, I would say about 5.
T, how many hours?
2.
2 hours.
Miracle.
Mom, how many hours of sleep?
7.
7? Okay. I got 7 hours of sleep.
Yeah.
All right?
Good day.
That almost
7
never
hours.
happens. My wife knows that I don't sleep. But I knew that I had to present today and I wanted to be extra well rested.
You went to bed early.
I went to bed early and stuff. So there's research that supports that sleep and weight loss goes hand to hand. All right? According to a recent poll, 40% of Americans get just 6 hours of sleep. Columbia University has indicated that people who sleep less than 7 hours per night are heavier and gain more weight. All right? Ideally, you want to get to bed before midnight because it improves the quality of your sleep. All right? So it's very, very important. And at the University of Chicago, indicated even if you eat healthy, if deprived of sleep, you don't lose as much pounds. So another reason why, just put it on snooze, put the alarm clock on snooze, get your sleep. And then a study from the American Journal of Clinical Nutrition indicated that individuals that sleep 8 hours burn more fat. All right, so sleep keeps the mind sharp and focused so you won't make bad decisions. If you're walking around, all groggy and stuff and you're not fully rested, you're not going to make the best decisions. When it comes to your health and nutrition and stuff. So another reason why sleep is very, very important towards your health, your heart health, and weight loss. All right. Meditation. Meditation is very, very important because you want to be able to have you time. We live in a very hustle and bustle, move kind of world. As soon as we get up, we hit the ground running. Baby's got to get dropped off at the babysitter, got to go to work. After work, pick up the kids at soccer practice, go to dinner. Before you know it, it's time to go to sleep and get back up again. So you never really have you time or me time. So meditation is important because it allows you to have that 10 or 20 minutes of calm, relaxed time. All right? And also, we talked about exercise in the body. We talked about exercise in the mind with books and positive material. Meditation is exercise in the spirit, okay? Now, spirit is in the middle of respiration. So breathing and spirit goes hand in hand, all right? You have to do deep breathing exercises to improve your spirit. So we're going to do a meditation together. So everybody close your eyes, get nice and relaxed, all right? Get nice and relaxed, and breathe in deeply. Exhale. Breathe in deeply. Exhale. Breathe in deeply. Exhale. Now doesn't that feel good? Just those few tranquil minutes. Alright, it makes a difference, especially when you do it for 20 minutes. So 20 minutes, get up before your spouse, your significant other, get up before that person, your kids, have your personal time. 20 minutes, 25 minutes is going to make a significant difference in your health. The benefits of meditation: it helps you develop clarity, calms the mind, helps reduce anxiety, lowers blood pressure, and promotes the improvement of your immune system. All right? So one of the things I like to do, I like to get up really early in the morning, about 4:30, 5 o'clock in the morning, and there's very good quality of air at that time. So you get a good, nice meditation. I go in my backyard, and I got a tree back there, and I just sit down and relax, and it's a great way for me to start the day. You know, other things like Tai Chi. Tai Chi is meditation in motion, all right? And yoga is also good, so whatever works best for you. But exercise in the spirit is very, very important. Cayenne pepper. Cayenne pepper is very, very important, all right? In fact, the cayenne pepper is in this picture right here. The cayenne pepper, the mint, and the lemon, all right? So what does cayenne pepper do? It lowers blood pressure. It's a natural remedy for cramps. Stimulates the body's circulation, all right? Stimulates weight loss by suppressed appetite, all right? Helps lower blood cholesterol. And it's an anti-inflammatory, and it helps against allergies, all right? So very important. Get you some organic cayenne pepper, all right? And supplement support. Supplements are very, very important because sometimes we don't get enough of the nutrients from the foods that we eat, all right? For heart health, this is the core 4 right here that I think that is some of the best supplements for heart health. Resveratrol, vitamin C, magnesium, and coenzyme Q10. Now some of these you can get them from foods, all right? And then some of these you can get them in supplement form. Things like magnesium, you can get it from food like spinach, almonds, avocado, black beans, and bananas. You know, coenzyme Q10, you can't really get it really that much in foods. So it's better to get it in supplement form. And also very important, people who are taking statin medication, they have to take coenzyme Q10 because statins lower your coenzyme Q10 in your body. So that's something that the doctor should automatically have the patient on. Of course, vitamin C, you're going to get it from oranges, strawberries, papaya, kiwi, and melon. And resveratrol, the resveratrol comes from red wine.
Red wine.
But the thing about it, you would have to have like about 40 liters of red wine.
That's okay with me.
In order to get the benefits of a 500 milligram of resveratrol. So sometimes it's better to get just the 500 milligrams of the resveratrol in a supplement form.
And sometimes it's better to have the red wine.
So yeah, so definitely coenzyme Q10, very, very important. And another added note, with coenzyme Q10, to help it to better absorb, you need L-carnitine because it increases its effectiveness. L-carnitine is also great for when you go to the gym. It's great for weight loss. You know, it's good for like after workout. You know, so very, very important for its absorption. Coenzyme Q10 is important for providing energy for the heart. Your heart beats 24 hours a day, so it needs a lot of energy to do what it does. All right, so that's why coenzyme Q10 is very, very important. So that's the 4 supplements, very important: resveratrol, vitamin C, magnesium, and coenzyme Q10. All right, in closing, Febin, who's responsible for your health? That's right. That's right. You are responsible for your life. You got to take charge of your life. All right? You have to take charge of your health. Not nobody, not your doctor, not your significant other, not your boss. It's you. You got to take charge and take responsibility for your health. Your spiritual health, your stress management, your exercise, your sleep, your mind exercises, all those things. All right? So every day make a decision that will improve the quality of your health. All right? And then choose to move. Park a little farther when you go to the grocery store. Park a little farther when you go to the grocery store. Upon rising, all right, in the AM, drink 16 ounces of water. All right? Even better, you can get the water like that. You know, get the cayenne pepper and the lemon and the mint leaves. All right? And take the stairs instead of the elevator. All right? So, hold on. One more thing.